Good morning.
Good morning.
Are you able to hear me this time?
Congratulations, Kim, on being the intern.
Thanks. Sorry you're all finding out at the last minute. We had plans to warn you a little better.
Morning, everyone. Sorry I'm late. Having issues with my PC.
We understand. We have to have that happen every time we have a meeting.
Yeah. Well, I've had problems with my Google Chrome. I think it's been corrupted. So be working with Geek Squad today to try to get that back rolling again. So, okay, now I have to find everything else. Okay. You gonna have everything now? Why don't we call the meeting to order? Affidavit of posting is as printed in the agenda. Entertain a motion for the minutes of March 12th.
I will move to,
Chris is,
yeah, there's one correction though to the minutes.
okay.
Under
Who's the
the
second?
heading of meeting minutes, the second paragraph, it says moved by Lois Krieger Dundrum.
Oh,
That's a
Dundrum.
typo.
I never saw that.
So
Oh,
I think she would appreciate it if we would amend the minutes accordingly.
yeah, that sounds good. Okay. I didn't hear who was the second.
I'll second that.
Okay. All right. So Chris's motion second with the corrections. All in favor, signify by saying aye.
Aye.
All right. First order on the agenda is introductions. Is it Beckler?
It's Beekler. Sorry if you're finding out at the last minute that we've had another change in directors here. Tyler left us. He's in the process of leaving. He's on vacation this week. He's officially done on Monday. I'm taking over. For those of you who haven't met me before, I've been the business manager for the health department for the past 4 years. I'm usually at the board meeting, so some of you have probably seen me before, either taking minutes or just being here to support the director. And I've been involved in pretty much all of our pandemic response, and I've been an active member of our management team. So we're hoping for a smooth transition. It's been an interesting first week. Nothing too terrible so far, so cross our fingers that it continues that way. But that's pretty much all I have to share. I'm excited to step into the role until our counties find somebody that they want to keep on a permanent basis.
Okay. Well, I wanted to make sure I got the pronunciation correct. Is it Beckler then?
Beekler.
Beekler. Okay. Well, welcome, and you've already been here, but welcome into the frying pan, I guess, more.
Thank you.
It's nice to see a familiar face.
Yeah.
Well, it's good to hear.
Okay. Next on the agenda would be then the Wic Program and Tobacco 21 presentation from Annika.
All right, Annika is our she's our senior health strategist, but she's also currently our interim health strategy director. And she's going to be doing this presentation for you as part of one of her grant objectives. I know it's something we've talked about in the past, but it's been a while. So I think it'll be a nice change of pace for COVID. You want me to? One moment. Bear with me one moment.
There we go.
All right, are you able to see my presentation here?
Yep.
Okay. Fine.
Having a little problem with the audio, cutting in and out.
Okay. Okay, I'll try to talk a little bit slower and louder. Is that better?
That's better.
Okay. Okay, great. So thanks for letting us join today. I'm joined by Brittany from LA, our hockey and
No, we're getting about every fifth word right now.
okay. I'll talk towards the camera. Great. So we're going to just do a little overview about youth tobacco use in Wisconsin. We'll talk about the WINS program, about Tobacco 21, and then we'll share information that we have for each county. So just to give the bigger picture overview, we know that, whether it's tobacco, cigars, chew, or e-cigarettes, it's all not good for youth. The nicotine can cause memory and attention problems, as well as a variety of other health issues. In Wisconsin, we've seen a dump in e-cigarette use among high school students. So back in 2014, around 8% of Wisconsin high school students said that they used e-cigarettes, while about 11% said that they were smoking traditional cigarettes. And now that has actually flipped. So in 2018, 20% of Wisconsin high school students were using e-cigarettes, while only around 5% conventional cigarettes. And we've seen this play out in both of our counties. So actually in 2019, some local high schools here in Ozaukee County ended up hosting parent events to talk about vaping. And in Washington County, there were 6 different community events. We also saw that Children's Hospital had patients coming in with EVALI, or e-cigarette and vaping associated lung injury. And then we saw the state and federal government declare youth vaping an epidemic. So this is something that's really been increasing as an issue over the past decade. We know that flavors also come to play. So, I don't know if you have seen products either in a gas station or in a vape shop, but it comes in pretty much every flavor you can imagine: candy, fruit, all different kinds of sweet flavors. Most youth say that they wouldn't try these products if they didn't fruit. We also know that the product type can vary depending on if you're in an urban, suburban, or rural area. So we see the e-cigarettes are more common in the suburban areas, and the little cigars and menthol cigarettes are more common in urban areas. That's largely due to the tobacco. So the Wisconsin WINS program is a statewide program that started to monitor sales to youth, to make sure that youth don't have access to these products. So it's a partnership between law enforcement, local health departments, coalitions, and businesses. It also includes the retailer training. So there's a website, witobaccocheck.org, that store clerks can do to make sure they know how to check ID and what the laws are around sales to youth. And then it also involves compliance checks. So this is where teenagers will go into a store, try to buy a product, and then see if the clerk is checking ID and if they will sell to the youth. We've had a federal law change that impacts sales to youth. So at the end of 2019, there was something called T21, or Tobacco 21, that passed. That raised the minimum age for tobacco sales from 18 to 21.
At this point, we don't have a state law that matches it, so it can only be enforced by FDA inspectors. So in Wisconsin, we have around 10 FDA inspectors that will go to monitor tobacco compliance overall. So at this point, for Wisconsin wins, we can only check that they're not selling to anybody under 18. So the last compliance checks that we did for Ozaukee County were in 2019. The program was paused due to COVID. So as of 2019, we had 58 tobacco retailers in the county. You can see in the map here, they're scattered across the 8 different municipalities. When we calculate the density, so the number of stores per 1,000 people, we saw that Saukville actually had the highest retailer density. Fredonia had the lowest. And we know that the more stores there are proportional to the population, the more likely people are to start smoking and the harder it will be for them to quit. Just because they're exposed to the products, they see the advertising, it's going to be harder for them to step away from it. We see some differences between the counties in terms of sales to youth. So Ozaukee County actually did really well in 2019. There was only 1 sale out of about 35 attempts. So that gives us a youth access rate of 3%, compared to 21% for Washington County, 17% for Milwaukee County, and 8% for Sheboygan. You can see the rate does vary from year to year. So the line graph in the bottom corner, you know, in 2015, there was a 29% rate, which is kind of an outlier. But other than that, it's pretty much stayed steady between like 2 and 10% throughout the years. So that's what I have for Ozaukee. Does anybody have any questions? Otherwise, we'll move on to Washington. Okay.
I did have one quick question. I'm looking at the sales to minors, and in negative things, Washington County doesn't often fall behind Milwaukee County. Do we have any kind of idea of, obviously the retailers are not doing enough. Is there something that we can do, that we can work with our sheriff's department to bring that more in line with what they're doing in Ozaukee County?
That's a great segue into the next slide, which is Brittany's portion. So I'll let Brittany handle that one.
All right, thank you.
Yep.
Hi, everyone. I'm Brittany. I work for Elevate in Jackson as a health educator. So I'm going to be talking about the local look of Washington County. In 2018, the Youth Risk Behavior Survey data showed that more than 1 in 4 youth in Washington County report using vapor products in the past 30 days. And in 2019, 21%. So that's 1 in 5 of the retailers in Washington County sold tobacco products to a minor. And as we see youth e-cigarette use increase, we are also concerned about the access and availability that youth have to these products in the county. Next slide. So when we first started Wisconsin Wins, the sales rate was actually more than 30%. And as you can see on this graph, we have seen a decrease over time. We were able to maintain a sales rate of 15% or less in 2015 to 2018. But then when e-cigarettes became popular with youth, we saw an increase in sales to 21% in 2019. And then next slide. So when we look at sales by retailer type, this is including vapor shops, gas stations, grocery and large retailers, and others, which that's including alcohol retailers who sell tobacco. We see that 38% of vape shops in Washington County were willing to sell to a minor in 2019. In addition to that, about 1 in 4 gas stations in the county were also willing to sell tobacco products to a minor. So next slide. So what are we doing about it then? So Elevate works with Wisconsin Wins to help with education and awareness through posts on social media, direct mailing, we do meetings, resources to retailers, law enforcement meetings, municipal clerks, county representatives, and the public. We also do positive reinforcement. So clerks who do not sell to minors during compliance checks also will receive a gift card. And then lastly, we encourage retailers to use the free training available at wisconsintobaccochecks.org for clerks. This website makes it a whole lot easier to train staff on tobacco sales laws and tracks completion of the course.
Do you know if that site gets used a lot?
Yeah, we can check who does use it, and it does get used quite a bit.
Can you tell where it's from? Like, can we tell if there are people retailers in Washington County that are using that site?
Yeah, so we can set our search bar to Washington County, and you can see what retailers are using.
Okay.
How many retailers, were approached for the 21%? You said how many were in Ozaukee County, but how many in Washington County?
So we have 111 retailers.
Right, but how many did you go into? How many?
I believe it was, off the top of my head, it was 83.
Okay. And how many were in Ozaukee County? Compliance checks?
Around 35.
Okay. That would also make the percentage higher too.
Mm-hmm.
I have one question. As long as we're talking about sales, can e-cigarettes be purchased online?
Yes.
So whatever those numbers are, we don't have any information as to that, right? So it could be higher in both counties in reality. Okay, thank you.
Yeah. So then my last slide, here we go. Yeah, so beyond our work with Wisconsin Wins, Elevate works hard to provide high quality evidence-based intervention for youth in the communities we serve. So this includes Too Good for Drugs, Peers for Peers, and Elevate You. Too Good for Drugs is actually what I teach as a health educator. So it's an evidence-based substance use prevention curriculum for students in grades 6 through 8th. That builds students' resiliency and ability to be independent decision makers. And then we have Peers for Peers, which is an evidence-informed peer helper program that recruits, trains, and supports high school students in grades 10 through 12 to act as peer educators, peer listeners, and peer mentors. And then lastly, Elevate You, which is an evidence-based youth early intervention program designed to help teenagers who are just beginning to have struggles with substance use, mental health, and school disconnection.
Are these voluntary on the part of the students? Or are
So
they required?
for all of them, they're not required. Too Good for Drugs is in Washington County and Waukesha County. Washington County schools, it just depends what schools want to have it. And then Peers for Peers is the peers-led program that's also in both counties, and that is by choice. It's kind of like a club. And then Elevate You is an intervention program that students go into if they do have struggles with that substance use, mental health, or school disconnection.
Okay, all right.
I wanted to ask a question, kind of what Chris had talked about before about the online. No, we do the education, we get the retailers to abide by and not sell to minors. Unfortunately, they're very tech savvy. They'll find out soon enough that they can order online to bypass all this. We can't even do statistics on it. How do we work with the online retailers to, I mean, how, there's always a way around. So how can we work with online retailers to do the same?
Brittany, I don't know if you have thoughts.
That's a really good question, something that I have really wanted to look into. I wonder if there's a way to send education to the online retailers. But I know it is a federal issue.
Yeah, I know that, I've got a law enforcement background, and we would work with UPS, FedEx, U.S. Postal Service for when drugs were mailed, or shipped in that manner, and we did an awful lot of interdiction and an awful lot of recovery, and made a lot of arrests through that. I don't know. This is a whole new thing. So.
Yeah, I think unfortunately that's not something we have control over, and so we focus on what we can control, which is our local environment.
Right, and education of the kids, and if they can learn that, how harmful these products are, I think if we make sure that when someone goes into the hospital with vaping with a lung injury, that the media gloms onto that, and here we have how many injuries, permanent injuries to lungs from vaping issues with juveniles. So, okay, thanks.
Well, thank you for letting us join the meeting, and if you have any other questions, feel free to reach out.
Okay, very good. I'll get back to my agenda. So, okay. Okay. Next would be the COVID-19 update.
Okay, back to our favorite topic. So I want to keep this a little bit brief on our typical updates, because we've got some changes that I'd like to share as well. First things first, our burden levels are still on a bit of a decline, which is great news for both of our counties. Hopefully we continue to be on the downward trend as more people become vaccinated, and we don't see any big spikes in the near future, but that's something we're continuing to watch. Schools, we're still working on partnering with our schools and our vaccinating partners in the area to push the Pfizer vaccine out now that it's been approved for ages 12 and up. That's very exciting for our communities. We're hoping that a lot of parents and children take advantage of that. And as those numbers continue to increase, we're hoping that that's going to continue to keep our overall burden on the decline. Currently, we are at 52.3% of Ozaukee County residents who have received at least one dose of the vaccine, and 40.4% of Washington County residents. So they're trailing a bit behind, but still better than it was last time we met. We're currently working on setting up Pfizer clinics in the area with a couple of our local partners. Oasis is one of our big ones. They have a Kewaskum event this Saturday, actually tomorrow at Wayne Elementary, from 9 to 1 for ages 12 and up, Pfizer vaccine. And then Thursday, May 20th, we have one at Vineyard Community Church from 12 to 6:30, also for Pfizer in Grafton. So there's at least a few of them in each county. And then in addition to that, we're looking into setting up additional clinics at our local libraries in both counties. It seems to be a good meeting point for a lot of our families, and we're hoping that that will get more children to participate in the vaccines as summer reading programs start up and families are looking for things to do. My only other big update with COVID is we are continuing to push our vaccine campaign on social media, hashtag WashOzVaxxed. I know we sent that out to all of you. We're still hoping more of our community partners join us in that. Share their stories on why they chose to get vaccinated, to help us continue to reach out to more people in our communities. And then we internally are still working on our stance on the CDC's update from yesterday that they're changing their mask recommendations. We typically follow the CDC, so we're still working on what that's going to look like for us, but it's good news. It means that more people are getting vaccinated. So we're just going to kind of have to see if they have anything more to say on the subject, and then we will put together our own thoughts. Do any of you have any questions on any of that? Any thoughts?
Okay. Chris, you have unmute.
Yeah, this was my 4th meeting this weekend. At all 4 meetings, no, well, this is virtual, but the others were in person. No one had a mask on. Granted, we're all probably, very mature and have had our vaccines. At least that's what I'm hoping. And so I think that's a very positive picture.
Okay, I do have one question. I've been, I talked when Kirsten was still here and when Tyler was running, and I was hoping that we would get back onto the dashboard, either the hospitalization rate or the hospitalization numbers. I know every time we get a spike, I'm very concerned if those hospitalization numbers follow that spike. I mean, we had probably about 4 or 5 weeks ago, we had a little uptick, but without those numbers, it's hard to judge what's actually happening out on the field. Are we getting an uptick with asymptomatic cases, or are we getting an uptick in some serious cases? And I know with the vast majority of our at-risk population has been vaccinated now. So I think it's important for the public to know that too. So it'd be great if we could work back with Eric again at our GIS and get that information out there for everyone.
Yeah, it's a great suggestion. I'm not sure why it hasn't been added yet. I will definitely reach out to him. I know we've been talking internally in the past week or so about changing some of our dashboard info around anyway. So that definitely can be added to the conversation.
Thank you. Okay, any other questions? Okay, we'll move to the communicable disease update.
Okay. So we don't have a whole lot of huge news for the CDC or the CD update this time. There's been we have a few ongoing TB cases. That's not really news since our last meeting, but it is something that we're continuing to monitor. And then this spring is tick season, so of course we're watching our Lyme disease numbers.
Now we're having audio issues again.
Oh, sorry. I don't know what you heard or not, but we're doing spring. Can you hear me at all?
Yeah, a little bit here and there. It's more, when you first talk, we can hear you, and then it kind of fades away and bounces. I hear you move your paper, but I couldn't hear you talk.
Away from my microphone. Okay. Can you hear me better now?
Yep.
Yeah. Okay. Sorry. So we have a couple of ongoing TB cases that we've been working on throughout the spring. We're hoping that we don't get any more in the near future, but that's something that we're watching. And then it's tick season, so we're watching our Lyme disease numbers, and we have been talking about revamping our sexual health coalition. That's I know been a big topic with our board throughout the past year, so we don't want to let that drop off. But I don't really have any other big things to point out from our communicable disease report. I do have Carol Lee here, one of our CD nurses, if any of you have any questions or concerns about it specifically.
Any questions, anyone? Okay. We'll move on to the Wic program update then.
Wic, the biggest news with them is that we have gotten a waiver for having Wic be in person through August. So that's good news for our staff as they're working on how to transition into reopening our building up. We're going to be doing a slow transition, having maybe people coming in for parts of their clinic visits. We want to welcome people back into our office, but make sure that we're doing it safely and making everybody feel comfortable as we do that. So we're still talking about what that will look like, but we don't necessarily plan on continuing to be closed through August. It's just nice to have the waiver for that long. Our numbers are still going up for WIC participants, which is great for us. We're happy to see that people are taking advantage of the services that we're providing. And we're going to have an outreach event at the end of the month that we're still working on putting together, but we're going to have an outreach for our farmers market program for the summer, hand out farmers market vouchers and partner with our nursing staff, and hopefully have a bunch of different vendors at this event. It'll be outside of our buildings in both counties, so that they can come and see what we've got to offer as we start to talk about reopening our buildings up. So we'll be posting more information on that in the near future, but we're pretty excited about it. Do any of you have any questions about it? The farmers market vouchers are also an exciting thing this year. They're much larger amounts of money than they typically give out. So we're hoping that a lot of our WIC participants get drawn back in to our department to come get those vouchers.
I have a question about the food pantries. I know back a few months ago, there were a couple of food drives that were actually canceled because the pantries were so full. Now with some of the gas shortages and some of the other things, and as this pandemic, the supply chain has been strained, to say the least. Now, how are our food pantries doing again? Are they still up? Do you have those figures?
I haven't heard any updates on it, so I don't know if it has changed recently, but that's something we can definitely look into.
Yeah, I would assume that if they were having issues, that they would reach out.
Yeah, they would have reached out, and we haven't heard any updates on that.
Okay, thank you. Any other questions? Okay, next meeting date.
Schedule here. I believe it would be July 9th.
July 9th. Maybe by then we'll be able to meet in person, so we don't have issues with our audio. What? I can't hear you again.
Said hopefully it'll be nice and warm out. Maybe we can meet in person in Newburgh. That'd be great.
Yeah, we can meet outside in the sun.
Yeah, the picnic table.
We've done that before.
Yeah, that would be nice. That would be nice.
Yeah, I've done that before.
Well, great. Well, that conducts our business. If there's any other comments, and hearing none, we're adjourned. Thanks, Ken. So have a great one.
Thank you, Kim.
Bye-bye.
Thank you.